Hello and welcome once again to Voice of Nottingham with Annu. Today we shall be talking about cancer. The aim of the latest NHS England cancer campaign is to encourage people who are experiencing potential signs of cancer to contact their GP practice to help increase earlier diagnosis and save lives. The campaign helps tackle fears around cancer, diagnosis, and the importance of body awareness when it comes to bodily changes that could be a sign of cancer. When cancer is diagnosed at an early stage, treatment is more likely to be successful. The campaign focuses on men and women over the age of 50 and those who may be more likely to experience a cancer diagnosis. Anyone can develop cancer, but people aged 50 and over are most at risk. So, it's important that we are aware of our bodies and anything that might be unusual. The campaign will reassure people that getting tested for cancer can help put their mind at rest if they have noticed a symptom that may not be normal for them. Don't carry the worry of cancer with you. If something in your body doesn't feel right, contact your GP practice. Today, we have Dr. Farzana Hussain on the show, who will answer some common questions surrounding this topic. Dr. Farzana Hussain is a highly accomplished GP with more than 20 years of experience as a practicing GP principal, now serving as a sessional GP in Newham. Her notable achievements include co creating and chairing the National PCN Network, serving as a clinical director for a primary care network, and receiving national recognition for innovative work in improving immunization during the COVID-19 pandemic. Welcome to the show, Dr. Farzana.
Thank you so much for having me, Anu.
Moving on to the questions. Dr. Farzana, my first question to you is, can you tell us a bit about the campaign?
Yes, of course, Anu. So, as you said in your introduction, the reason the NHS is running this campaign is because we know that when cancer is caught at an early stage, it can sometimes be curable and certainly very treatable. And we're really trying to increase the awareness of cancer because there are lots of different cancers and they can present in different ways. But we often are the experts of our own bodies. We know when something feels a bit different to us. And so this campaign really encourages people to be aware of our bodies and to seek help if they feel that there's anything wrong at all and to speak to their GP practice sooner rather than later.
So, Dr. Farzana, what happens if cancer is diagnosed early?
So when cancer is diagnosed early, Anu, sometimes I said it can be completely curable and treatable. And a lot of people are, including me, we're very afraid of the word cancer. And so often we don't want to seek any help because we believe that if we've got cancer, then that's a death sentence. And that's certainly not the case. Cancer caught early is very, very treatable for the majority of cancers.
And coming to my next question, who is most affected?
So generally, people who are aged over 50 are more affected, although it can occur at any age group, but definitely the over 50s. And one of the things a recent survey found is that only half of us, well, just under half, 46% of South Asians, only under half of us regularly check our bodies. So if we don't really check our bodies, we wouldn't be able to know if there was a difference happening. And one of the reasons I'm delighted to talk to you today is to really help people think about how to check their bodies. And I'll be talking about some of the signs and symptoms.
Fourthly, what are the common causes?
Yes. So this is a very great question, Anu. So there may be lots of causes for cancer. There can be cancers that run in the family. There can be lifestyle things. And sometimes we just don't know. And this is why it's really important, even if you don't have any cancer in the family, to always seek help if something doesn't feel quite right to you. And as I say, I'll go on to common things that people can look out for.
My next question to you, Dr. Farzana, is what should people look out for if they are concerned about something?
Yes. So there's a couple of things, and I would say 5 or 6 things that are really important. So if we find any lump anywhere in the body, and a lump that just wasn't there before, so something that is, growing out of something, it just wasn't there anywhere in your body, that's something that you should immediately seek help for from your GP. If you find any blood in your wee wee or your stool, your urine or your stool, your wee wee or your poo poo, even if that's just once, we should definitely seek help. Don't think, oh, it's just once, it might go away. Might be nothing, but it's always important to check. For ladies who have finished their periods and have had the menopause, we should never get periods after we've finished and after we've reached the menopause. If there's any bleeding from the vagina after that, we should seek help. And for ladies who still have their periods, if you're getting bleeding after sex, after intimacy, or you're getting bleeding between your periods, then you should seek help from your GP. A couple of things that we can wait a bit longer, Anu, for. So if you felt like this for 3 weeks or more, is that if you've had a cough for more than 3 weeks, if you've had tummy discomfort, so that can be either diarrhea or feeling bloated or suddenly noticing that your bowel habit has changed. It was normal before, now it's constipation. It was normal before, now it's diarrhea. You should certainly seek help if that's been going on for more than 3 weeks. Or even if you've got a sore ulcer in your mouth or a sore in your mouth that hasn't gone away in 3 weeks. So a cough, tummy troubles, or a mouth ulcer or sore for more than 3 weeks. So these are the 6 things I would recommend that we should definitely be seeking urgent help for from our GP.
And why do you think there is a reluctance in the community for people to see their GP?
Yes, well, I think there's a couple of factors, isn't there, Anu? I think many patients understandably feel it's hard to get a GP appointment and they don't want to waste the GP's time. I want to reinforce as a GP, you're not wasting our time. It's lovely for us to say, actually, you don't have cancer and reassure you. We'd much rather do that than find that a cancer has been caught at such a late stage that there's not much we can do in terms of treatment. I think people are often also afraid. They don't want to discuss it and they're afraid to discuss things with their family because we all believe that cancer is not treatable, and it certainly is. And I think people are quite afraid sometimes of the diagnosis. But even if it is cancer, if it's caught in the early stages, I can't emphasize enough that it is treatable. So, I would please urge people to come forward and speak with their GP practices.
And what if I'm not sure my symptoms are serious?
Another really good question. We found in our survey that 2/3 of us, so more than 67% of us South Asians, would actually wait more than 3 weeks for any of the symptoms I discussed. And 38%, so nearly 4 in 10 of us, do delay seeking help, even if they feel it's something serious. I would say you're not wasting your GP's time at all. If it is caught early, we can really help treat it. And if it is nothing to worry about, then we can run the tests and reassure you. So please don't worry that it's not serious enough. You wouldn't know that. Even I, as your GP, without tests, wouldn't know that. So please come forward. Don't worry about wasting time because we want to treat those cancers early.
Dr. Farzana, what happens if my GP refers me for tests?
So there are various tests depending on what sort of cancer you and I are concerned about. But some of the tests are really easy and can be done in your GP practice, and we can reassure you if they're negative. And some of them need to be done by the hospital, and they'll see you very quickly. So a lot of these tests can absolutely reassure us. And as I say, if they're not negative and they're not normal, we can certainly do more tests to see what happens. And if it is cancer and it's an early stage, we can go ahead and treat that quickly. For more information, you can go to nhs.uk/cancer symptoms, and this will give us more information on cancer signs and symptoms. That's nhs.uk/cancer symptoms.
Thank you, Dr. Farzana. It was definitely a very informative session. To all who are listening or watching us on Radio Faza 97.1 FM and DAB on the show called Voice with Anu, I would request you to remember that for more information on cancer, signs, and symptoms, you can go to nhs.uk/cancer symptoms. I repeat, nhs.uk/cancer symptoms. Stay healthy, stay hearty, and stay aware. Thank you.